Welcome to Better Sex, where you get the information and inspiration to create and enjoy your best possible sex life. Join your host, sex therapist Jessa Zimmerman, as she brings you expert guests, helpful tips, knowledge, and strategies to improve your intimate relationships. And now, your host, Jessa Zimmerman.
Hey, welcome back to the Better Sex Podcast. This is Jessa. Glad you are here with me today and choosing to spend a few minutes learning about sex, investing in your relationship, trying to make the best intimate life with your partner that you can have. Those are my goals. That's what I'm trying to help you do each and every week as I bring you different topics that could be relevant to you. So something that's been on my mind lately is desire discrepancy. I mean, this is always on my mind because this shows up with my clients in my practice all the time. And while nothing is wrong with one person having more desire for sex than the other, that's actually totally normal. Nothing's broken, nothing's going wrong, that's not a problem. We do also have to look at the kinds of things that get in the way for people that are making it more difficult. And of course, those factors are innumerable, almost infinite. So many different things can be impacting somebody's sense of desire for sex. And one of those things is physical. Actually, lots of those things are physical, but I'm thinking specifically about pain with sex, and I'm thinking about especially after birth, after having a baby. You know, not only do you have exhaustion, you've got relationship changes, you've got the stresses of that, you also may have the physical after effects of birth. And that's whether it's vaginal birth or C-section. You know, your body has been through a lot and sometimes doesn't quite bounce back the way you might expect. And of course, if that's going on for you, if you're having issues of incontinence, if you're having issues of pain, if you're just having issues of fear, you know, and tentativeness, if that's the word, you're going to want to address that. A lot of this stuff can be helped. So that's the point of my show today. We're going to be talking about specifically the physical effects of birth and the use of physical therapy in recovery. So whether you see an actual physical therapist or you work through some of this stuff on your own, there are things you can do, physical therapy types of things, exercises, stretching, and breathing that can make a real difference in your recovery of your sexuality after birth. So an important topic if this is something you're going through. If you're not, maybe you'll learn something. It'll be relevant to you later or to somebody that you know. But anyway, great conversation. My guest is Kathe Wallace, who is really an internationally recognized clinician. She wrote a book about this in terms of reviving your sex life after childbirth. She is a PT. She has trained people in pelvic floor physical therapy for years, sort of pioneer of this. So I'm lucky to have her as a colleague in Seattle. We have shared clients for very many years, and I'm just really glad and fortunate she could be on the show to bring her expertise. Hopefully it'll be interesting and maybe really useful for you. Hope you enjoy it. Kathe, thank you so much for being on the show with me today.
It's great to see you and hear you and connect. Boy, it was when you first started that I think you asked me to be a guest, and here I am.
It's like I was describing to you before we started. I have done so many interviews, and I have usually 20 of them that are done that are unreleased at any one time. So I'm working way ahead. So
that's great.
Yeah.
We're all interested in every topic.
I know there's no shortage of things to talk about. That's for sure.
Thank goodness.
So your expertise as a pelvic floor physical therapist, you know, I think is so important. It's something I refer people, you know, in my practice, I refer to that a lot. But we want to talk today specifically about postpartum pelvic floor concerns and treatment and issues, right?
Yeah, I, in my practice, have worked with the pelvic floor since 1988. And early on, the postpartum mother seemed to have a lot of issues that no one was paying attention to. And it was actually the motivator for me to get involved in this was my own personal childbirth educator who said, there's women with problems and no one's helping them. And, it sparked a little bit of what happened in my own delivery, which was a very wonderful, normal delivery. But still, my body wasn't the same. And the knowledge of my pelvic floor and what I understood about it, I knew it was going to get better. It wasn't, I didn't have a tear. I didn't have a lot of the issues that a lot of women have. But I could see that there was a lot that could be learned and taught in this area. The musculoskeletal system is really not addressed by obstetricians. And the pelvic floor is a muscle in that system.
Well, so it's a number of muscles in that system, right?
14 to be exact.
Okay, right.
So doing your Kegels, quote unquote, is not as easy as it seems. And when you don't have sensation or you have discomfort within your pelvis after delivery, it can be a real challenge. Right. Add on, breastfeeding changes in hormones, add on a massive fatigue, perhaps stress, perhaps I don't feel so sexy anymore. Everything like that. And there's a lot of things that can build up and not get taken care of. So.
Right. And I've done an episode on postpartum sexuality, at least maybe even more than one at this point. But it's just so interesting to focus on the sort of physical, not that that's divorced from everything else, right? But to really take a look at what happens physically if you deliver a child. And I assume, are there impacts on the pelvic floor if somebody has a C-section too? Or are we largely talking about just vaginal birth?
Well, that's a very good question. It really depends on how that C-section evolved. Did the woman labor for many hours trying to push and then emergently had a C-section? Was it a planned elective C-section for medical purposes? Those two scenarios will have different effects on the pelvic floor.
Right.
But a scar in the abdomen from a C-section can also cause adhesions and pain within the abdominal viscera and the reproductive organs. So it can cause some changes as well. We typically think of vaginal birth, and I think that's a mistake. I think that women with C-sections are known to take longer to recover their sexuality because they've been through a major operation.
Right.
Not that childbirth isn't.
That's major in its own way.
Labor for a reason, right? But no, a C-section woman can have significant problems as well, and not as many stretches in regards to stretching or laxity of their pelvic floor. But they can have them. Yeah. Okay.
So what are the most common impacts, I guess, to the pelvic floor from giving birth? Like, what are the trends or the conditions or the symptoms that you see?
We kind of break it up into a few different categories. When someone comes in with a problem about their sexuality, and by the way, I think it's the biggest driver for them to come to physical therapy, even if they might have some urinary leakage. They're afraid to sneeze. They're afraid to be sexual in that regard. So some of the biggest problems in my book that I wrote, I talk about sort of two basic categories. One is one of tension and holding left over from a painful scar, and the other is more laxity, a little bit of muscle weakness from the stretching that occurred during the delivery.
Okay.
So if you break it into those two categories, they're actually treated quite differently. The first thing that we do, though, in pelvic floor physical therapy, of course, is take a history and find out what type of birth it was. All vaginal births are not created equal.
Right.
And some women wind up with just a small little tear or some stretching. And then there's operative vaginal deliveries with interventions of the vacuum or the forceps. And they are known to have more problems with scar tissue and sexuality postpartum. So if we start talking about those, also women that have had an anal sphincter tear during delivery are also known statistically to take longer to get back to sexuality, but also have more pain and dysfunction. And
Right.
in countries outside the United States, they are automatically referred to physical therapy. Yeah,
Really?
and some places they are in the U.S., but it's just starting to be a known entity for those women.
So are most women that seek you out for this, are they coming in because of pain?
Pain is the biggest driver
Okay.
for some sexuality issues. Sometimes there's a complaint of laxity and looseness. And the first thing I think that they need to understand is that when a muscle has gone through the certain amount of stretching and swelling and changes that occur when there is a vaginal delivery, that it will be painful for a certain amount of time, but they have to understand that typically it's not a danger to their body. And I think that when we do an exam, I can tell where the scar tissue is. Is it more on the posterior wall of the vagina? Is it more on the anterior wall of the vagina? And this can even help with coaching on, penetrative entry. What position, if you have rear entry versus front entry, you're going to have a different effect on the anterior and posterior walls of the vagina.
Right.
So just little cues like that have really helped women understand their body more. And I think that's one of the biggest issues is they know it hurts, but they don't know where or what to do with it. So as long as we can help define and understand that, it really takes that stress, anxiety, and worry away. And that I found was a huge issue. That plus sometimes the pelvic floor will respond like the shoulders do when you're tense. It will, tighten and hold on. We call it overactive pelvic floor, hypertonic pelvic floor. And without the ability to recognize it, we're really not able to let go enough to get involved in our sexuality, I think. That physical release has a mental component, but it also has a significant physiological need to stretch or relax the muscles.
Right. So you've mentioned laxity a couple of times. And as a sex therapist, sometimes I have people come in and are afraid that by having sex a lot, they're stretching out their vagina or they need to let it tighten back up before they have sex again. They have this sort of misinformation.
Interesting.
Because I try to tell people vaginas are meant to stretch and then they come back together. And it's like, that's a natural process. But so how different is it with birth? I guess I would have assumed vaginas just sort of come back together. And yes, it's been through a trauma, but it's not like it gets all stretched out, is what I would have thought. But you're talking about laxity is potentially an effect of birth.
Yeah, it's not a great word that I use with my patients because it does imply, how should we say, abnormality. So if I have laxity, I can move around really well in bed too, right? Okay. So let's think about if I do neck stretches, is my neck going to wobble and fall off?
Right.
No.
Not put your head up. Okay. Right. Yeah. Yeah.
The biggest difference is that the pelvic floor muscles really only have a few bony attachments, one on the pubic bone, partially on the tailbone, but there's a lot of fascia and connective tissue that when greater than 8.4, I think is the number they say, pound baby. But, every vagina isn't the same size, nor are the hips the same size, but a larger infant, perhaps, or a longer pushing stage, usually greater than, some people say 2 hours, some people say 3 hours, will cause a prolonged stretch on that connective tissue.
Okay.
And because of the fact that, again, the pelvic floor has so much of that fascia and connective tissue, those respond, they take longer to respond to recover.
Okay.
So that is the biggest issue in regards to that. It really does take some attention to use the muscles to get a feeling of closure in women that have felt that stretching. But within the first, I think, or we're going to call it the fourth trimester now, the first 3 months, because that's the new lingo. It's not new, but I think it's a really important lingo that it takes a long time for our body to recover, and that people also sometimes want it better now. Yeah. And women, sometimes it's like, what happened? Like, am I going to be this way forever? Right. And just understanding that the normal recovery is reality, but then some people will need additional rehabilitation. Okay.
So how do people know? Like, what would a woman be experiencing where she'd say, okay, I just need some time, versus I should go see a PT?
I think they should trust their gut on that. In some ways. I think that if they know they had a difficult or traumatic delivery in any way, and I don't just mean an operative delivery, I mean psychologically traumatic. Oh, okay. Delivery, I believe that it changes our perception of how we can use our body. Mm. And so traumatic deliveries are one. I also believe that an assisted delivery with vacuum forceps and episiotomy, I think will need some extra help. Okay. The minimum, though, the reason why I wrote my book was that I think that if women knew to maybe move the perineal skin before they started thinking about even penetration, so we're just going to say with a dildo, with a finger, whatever, they would be much more aware of what it feels like. And so the concept of moving a scar is very common in musculoskeletal recovery for the physical therapist, but it hasn't really made it to C-sections and episiotomies or just a little tear. Yeah. Like, move that tissue, we can see which way it hurts, which way it doesn't hurt. I've had people steering different directions with their sexual activity depending on where that scar moves better or not. I mean, there's so many things that if we understand how our body works, will really help the woman engage more in her sexual action rather than be fearful about what she's feeling.
Jessa here, just taking a quick break. Thanks for listening. Are you interested in being a guest on the show? I'm always looking for people with expertise to share that could enrich other people's sex lives. And I'm also interested in hearing from people who have transformed their own intimate relationship and would want to share their story with my listeners. So if you've got something to contribute to the discussion and want to see about being featured on an upcoming episode, please visit our website, bettersexpodcast.com, and check out the Be a Guest details. You'll find everything you need there. Okay, so a big baby, a long pushing stage, intervention in birth, traumatic physically or emotionally. Any other sort of clues or red flags that somebody might say, wait, I should go see a PT? Like, for instance, you mentioned a little bit of leakage incontinence, right? Is that something that is normal in the fourth trimester, but if it continues on, they should get some help? Like what?
I was recently at a Canadian meeting of urogynecologists, and there's a prominent physician who works with postpartum trauma. I said, how long do you think we really need to wait? And we had to talk about the psychology part, the trauma part.
Wait for sex? Is that what's
no, wait to get physical therapy.
Okay, to get PT. Okay.
Yeah, well, wait for sex is another issue.
Right. That's just something that comes up in practice, right? So, yeah.
He really thought if at 3 months there wasn't something going, it wasn't improved. There really should be. There are people that say, if you're leaking at 6 weeks, you may continue to leak.
Yeah.
I think it also has to do with symptom of bother, but we're also talking about a woman that's got a new infant to care for, fatigue. We're talking about like getting to an appointment is a major event for the majority of people. So but starting self-help at home, beginning to be aware of how to properly do a Kegel exercise should start, within the first 2 weeks.
Okay. And I assume this is what your book is actually for, right? This is a sort of do-it-yourself for women that who want to tackle some of the stuff and can't get into the office.
It is. And there was so much after the 6th woman said, why didn't anybody tell me this? I was like, I guess this is really time to really take care of some of these basic issues, right?
Right. Okay, so what can women do at home? Like do you have a sort of a protocol or series of steps or just some different tips?
Yeah, I do. I think understanding their body and their body parts, they can get all the way through pregnancy and not really know much more than where their vagina is.
Mm-hmm.
So I do some things for body awareness and education on their anatomy, clitoral anatomy, things like that. But also if they're having pain, which was one of the drivers again for the book, is like, where does it hurt? How does it hurt? Can you move it? Can you talk to your partner about moving it? Are there any signs of things that are of danger?
Yeah.
So that's sort of the first step. If we don't understand our bodies, we're not going to be able to know where to go, I think.
Yeah.
And then also, I think the other, a lot of women have been told to just use lube. But a lot of postpartum women think that lube is for old people. And they don't understand that breastfeeding, mimics a menopausal woman. And it's a myth that a lot of people can just naturally lubricate.
Right.
Now, it is important to understand that the pelvic floor muscles sort of sandwich the Bartholin gland, which is our lubrication center, right? And if we contract and relax, we might help enhance some of that. So hands down, the studies show that use of the pelvic floor muscles postpartum help all the arenas of like arousal, lubrication, desire. So it's just so valuable to start using it again.
Okay.
As you can.
Yeah.
So it just makes me go right to the segue of, how do you use it? And
right.
I think just the old concept of squeeze to please is okay, but it doesn't really hone in on what we're talking about. And I'm going to focus on more the internal cues. I mean, people know if I stop the flow of urine, if I don't let a tampon fall out. These are things that facilitate a muscle contraction. But if I hold back gas, that'll also facilitate a muscle contraction. But if we think about it from the anatomical point of view, there are muscles attached to the clitoris, and they actually, make the clitoris nod. and move. And so if you can think about nodding your clitoris and winking your anus, so wink and nod sounds a little bit like a child's
It sounds anthropomorphic, right? Like these are people.
little book for children, wink and nod.
Yeah.
So the concept is that moving the clitoris, closing the vaginal lips, winking the anus kind of gets the first layer of muscles. And then to get the deep layer, you sort of bring your anus to your pubic bone. So there's like many steps to really engaging all the muscles. And then people can identify, well, what is the harder part that I should be working on? A lot of women are, in my experience, were more thinking about squeezing their buttocks and holding back gas rather than thinking more forward into the vagina, the closure of the vagina, and the nodding of the clitoris.
Oh, okay.
To really kind of use all the muscles that are involved in the sexuality.
All right, which might indicate that those muscles need a little bit more attention or work, right? Yeah. Okay.
And the body is an amazing thing. If we send messages, they get through, and it's working again. It's fabulous.
And what I would imagine you would suggest doing this kind of work, before the birth too, right? Like people, if they're attentive to their pelvic floor, are they likely to have a better outcome after delivery?
Well, the data, I have to go back and look. There used to be a lot of like, oh, don't do too many, you'll be too tight, like concepts. But I think it really depends on where that person's starting. Because if they're starting with an already tense pelvic floor, which is the other topic we need to talk about.
Right.
Doing more isn't better.
Okay.
Learning how to release is what we need to do.
Okay.
So prenatally, learning releasing and opening of the pelvic floor is so critical to the delivery process.
Right.
But we also have to learn how to bring it back up and in, right?
Yeah.
But in the prenatal population, I don't believe that there's a childbirth class out there that doesn't mention the pelvic floor and its role in childbirth. I think it's really, do we need an intense training program? Depends on what's going on with that particular client.
Okay.
Right?
So what can women do on their own in terms of relaxing their pelvic floor, releasing if they've had that emotional trauma or they're, experiencing pain or something like that?
The pelvic floor, because it holds in the bowel, the bladder, a lot of people aren't anxious to let go of them.
Right.
So the feeling of releasing can be a foreign concept for a lot of people. We use breath for the most part to help. And I think the concept of diaphragm breath really needs to be defined more clearly. I think the general person that I might put in a stereotypical category of a person with an uptight pelvic floor or tight pelvic floor, maybe someone who's driven, who works hard, who does things hard. And then they've heard about breathing exercises where they're supposed to like breathe with their belly. So then they lie down and they push their belly out, and then they're still working.
Okay.
Trying to do their releasing. Some have come up with the term of tension-free diaphragm breathing.
Okay.
Serena, my business partner at the Pelvic Health Clinic, and I started talking about expansive tension-free breathing. In other words, your diaphragm, your breathing diaphragm is like an umbrella. It works really well in Seattle, and it opens in all directions. And that's what we want to happen with our rib cage and with our belly. And that change in the breath, with that, the pelvic floor is supposed to descend. So the pelvic floor really descends just a few millimeters. I mean, not a lot with every breath. But the concept of breathing in, to open your pelvic floor is a relatively new one for people who have high tension.
Okay.
And so we work with the breath. We can use biofeedback. We can use bony landmark points. We can help to see if there's a reason. If they have pain in another part of their body, they may be holding unconsciously to try and prevent pain.
Right.
So there's many steps along the way that will help somebody. So a change in what's happening with their musculoskeletal system, but using the breath is one of the main ways to learn to.
Okay. And is it pretty, am I putting this together right? Is it pretty easy to tell whether you've got too loose or too tight a pelvic floor after birth? I mean, it sounds like loose might be incontinence and.
Yeah, it's not.
Okay.
Unfortunately.
Okay.
And that's the biggest, about, I don't know if I look, but at least 50 times in my book, if this doesn't make sense, get help.
Okay.
One thing is that a pelvic floor contraction shouldn't hurt.
Okay.
So if a pelvic floor contraction makes your tailbone hurt or you're getting pain, you may already be too tight, or there may be something going on with that. We can examine in physical therapy for changes in tone from one side to the other. It's very common also for a woman to have a hip problem on the same side that their pelvic floor is tight because of the muscle fascial connections.
Yeah.
And so if we treat the hip, sometimes we can help the pelvic floor relax as well.
Okay. And I guess you also talked about scar movement, tissue movement. Like that should be a piece of what women are doing, is touching their body, moving things around, making sure everything seems flexible and pain-free, right?
So that kind of comes into the category of, well, where is that scar tissue, or where is that tight muscle? A massage on a tight muscle usually feels good, right?
Yeah.
There are internal stretching tools and devices that are available. I do talk about how to use them in my book too.
Okay.
Because sometimes the muscle just needs to be stretched or let go, and the proprioceptors learn that they can release, or they learn a new sensation, and that can connect with the brain to help the woman relax as well.
Yeah.
So the use of external, like massage on the tear, as well as just some myofascial stretching along the muscle, can lengthen it and open it and give it a less pain on touch as well. It can be less sensitive over time.
Right. Okay. So I want to give you the opportunity to just talk about your book a little bit, but also would you let people know where do they find a pelvic floor PT? Because, we're lucky in Seattle to have you, and now numerous other people too. But, how do people even find this? Because a lot of people don't even know this exists.
Yes. And the good news is that there are now several websites where you can go and put in your zip code and find a PT.
Okay.
Awesome. And one is the American Physical Therapy Association.
Okay.
APTA section on women's health has something in their tab bar says PT Locator.
Okay.
And you click on it and you find one. There's also one on pelvicrehab.com.
Okay.
And another one on pelvicguru.com.
Okay.
They're PT locators.
Right.
If they go online, they'll probably also just, if they Google somebody within their zip code, they may or may not find somebody. You're right.
Right.
It's a growing area in physical therapy.
Yeah.
So,
which is good.
But it's not really entry level training. There's more advanced training.
Right. So it's important. I mean, that's a good point. It's important for people to find somebody with training, with a specialty in this, right? Not just your sort of run of the mill PT that says, "Oh, sure."
Well, you'd be surprised. I mean, run of the mill. we have basic understanding of the muscles in the system, and they'll know where to send somebody as well, perhaps, or recognize when it's outside their scope. But sometimes they're going to identify that musculoskeletal problem that might be driving that specific pain and give basic information. It's sort of like the implicit model for sex therapy, right?
Right.
So.
Okay. And so what's the name of your book and where can people find it?
Oh, thank you. It's called Reviving Your Sex Life After Childbirth, Your Guide to Pain-Free and Pleasurable Sex. And I wrote it by desire and passion to help. It is, if you click on my website, KatheWallace.com, you can find a link to Amazon, but it is on Amazon.com, and that's the main place.
Okay, perfect. We'll put a link in the show notes too, so it's easy for people.
Yeah,
so.
That'd be
great.
Awesome.
Thank you so much for being here to talk to me and the audience about this.
Yes, I think that every woman needs to understand their pelvic floor better. Men do too, but we're talking about
we'll do them another time. So.
Okay, perfect.
Great. Thank you.
Uh-huh.
You've been listening to Better Sex. Please visit our website, bettersexpodcast.com, for show notes and additional episodes.
And that's a wrap for today. I really hope you enjoyed the episode. If you are enjoying the podcast, if some of this material resonates with you and you would like to make a difference and make sure that this keeps coming out in the world once a week, ongoing, there are a couple things you could do to show your appreciation. The first would be to go to iTunes and rate and review the show. That really helps us be found by new listeners when you review the show on iTunes. You can find a link at bettersexpodcast.com/iTunes. The other thing I want to invite you to consider is becoming a Patreon. For a small monthly pledge, you get some benefits. So for $2 a month, you get advance access to every single episode. For $5 a month, you get a chapter of my upcoming new book. And for $10 a month, I host quarterly get-to-know-you and question-and-answer chats over the web, and you get invited to that. I would love to have your membership in that, become part of the Better Sex family. You can find a link at bettersexpodcast.com/Patreon, which is Patreon. Again, thanks for listening. I'm glad you're here. Feel free to comment, ask questions, get in touch. I'd love to hear from listeners. Thanks.